2022 management reviews. And we want to help labs move from just compliance to ensuring that our management reviews influence real strategic decision making in the organizations we're working for. So once again, we have a disclaimer. This presentation is for educational purposes only. While every effort has been made to ensure the accuracy of the information regarding ISO 15189-2022, this presentation does not constitute official accreditation advice. Labs should always refer to the official ISO documents and their specific national or regional accreditation body requirements. About the speaker, the person speaking to you today is called Innocent Mdlongwa. He holds a master's degree in clinical epidemiology with over 25 years experience. He's a QMS consultant. He's a certified lead ISO 15189 auditor, a SLIPTA auditor, a SLAMTA trainer, and he has led multidisciplinary teams evaluate and assess labs in the region covering Botswana, Malawi, Namibia, Rwanda, Tanzania, Zambia, and Zimbabwe. And this webinar is hosted by a company called CLISS Quality Advisory. This is a legal entity registered in Botswana. And CLISS is an acronym which means Consulting for Laboratory ISO Systems Strengthening. And through our name, we promise and that we exist to hardwire global best practice into every test, every calibration, and every report your facility produces. And we are here to work with you. Our mission is to strengthen lab compliance across Africa and beyond. And we offer end-to-end management systems consultancy. This includes ISO standards training. We cover ISO 15189, 17025, 17043, the ISO 9000 series. We do offer trainings on those as well. We do offer accreditation mentorship, which includes gap analysis audits. We do offer training on risk management. We know is a hot topic. For the new standard, we offer training on risk management as well. We guide laboratories from initial gap analysis to successful accreditation, ensuring a seamless journey towards excellence. Could I please post the poll? We know we have over 350 participants that registered to participate in this webinar today. And we did take a chance to see where people are joining in from. And I must say, we have close to 30 countries represented from the registrants, but we also want to understand at what level you are coming in. Please let us know whether you're a lab director, a lab manager, quality manager, what best describes your role in the current organization you are working for. Are you a head of section covering a particular section like molecular chemistry, or you are coming in as a program manager to support lab system strengthening, or lab systems mentor? We also have people coming in as research scientists. Are you a senior lab scientist, or you are one of the testing personnel in the organization you are working for? And you appreciate that management reviews is a management activity, and would really want to appreciate who we are talking to today. I see we have 53, about 50% responses so far. Hope you can only see the poll. Please respond. We're at 56% now. We would appreciate if we have more respondents so that we get to know who we're talking to today. 60% now. Please keep responding. If we can push it to say 75%, we're at 61% now, 62. Let's have more people coming in. 62%. 62%. Okay, we'll stop it here for now. Could I please stop it? And share the results. Okay, so of the people participating here today, I see we have 26% lab managers, 33% quality managers, heads of sections, about 6%. We don't have program managers, but we do have lab system strengthening mentors at 14%. We have senior lab scientists at 9%, research people 3%, and about 9% general testing personnel, which is quite a good distribution. It would have been better if we had a lab director at least, because lab directors form part of what we call top management. And this presentation speaks directly to top management. Otherwise, thank you so much for your responses. Thank you for the lab managers, the quality managers that are here present today. We hope that our presentation will be able to assist you in your delivery of activities. So in our webinar today, we have quite a mouthful to deliver. We'll look at ISO 15189-2022 evolution. We'll also look at management review fundamentals. We'll look at planning and preparation for management review. We'll talk about review inputs, and we'll talk about conducting the actual review, the review outputs. We'll then also touch a bit on technical adequacy, and then talk about strategic improvement, the common pitfalls that you normally find in the management review process, and talk a bit about practical tools that can actually help your management review process so that your process is effective. At the end of the day, we want to see management reviews that are influence data-driven decision-making, driving costs down in the organizations we're working for. We also want to see labs optimizing supplier contracts and performance, and influencing the decision as to whether you are keeping the suppliers or you are changing the suppliers. We want to also see data-driven approaches to shortening turnaround times. We also want to see labs improving in terms of boosting staff engagement and fostering the culture of quality in the laboratories we are working for. We also want to ensure that management reviews drive and create objective evidence for governance in decision-making in the different organizations that we are working for, so that indeed our decision-making is data-driven. Okay, so just a bit on ISO 15189-2022 evolution. We know that we recently moved from 2012 to 2022, and in our presentations, we'll always endeavor to include a slide so that all our participants are aware of where we're coming from and what are the new things that are coming with ISO 15189-2022. I know we're 3 years on, but we still want to remind each other as to what changes and how these changes are driving our approach to management reviews. So one of the key things that came with 2022 is the structural reorganization of the standard itself. And there is also now focus on risk-based thinking, which says let's approach everything we do in a proactive manner rather than reactive, and only focusing on correction. So you'll remember, those of you who have been with us for some time, that in December we did have a presentation talking a little bit about that. Then the new standard also comes with emphasis on patient-centered focus, and this has an impact on the way we approach our activities in the lab. Also new in 2022 is integration with POCT, which we know that was covered by a separate ISO standard 22870. So that was discontinued and introduced and integrated to ISO 15189-2022. Okay, so what are the implications on management reviews? It then means risk assessment form the center of the approach to management reviews. It is not to be considered as a separate compliance activity, but it must be an integral part of the management review process. And our focus should be on patient outcomes. We should be asking ourselves this question when we are doing management reviews: what has this got to do with our patients, the patients that we are serving? Also has influence on data integrity and flexibility. I'm sure it's not the first time you're hearing this. ISO 15189-2022 brings an approach that is less prescriptive, and it is more focused on outcomes. So our approach to management reviews should carry this with it. Risk management, again, must be a central agenda item. Evaluating risk register status, reviewing mitigation effectiveness, identifying imaging risks, and linking risk treatment to resource allocation and improvement actions. This is very critical. Okay. Management review fundamentals. We also need to understand what a management review is. This is defined in the standard 15189-2022. We know this is covered under clause 8.9, and the standard says the laboratory management shall review its management system at planned intervals to ensure its continuing suitability, adequacy, and effectiveness, including the stated policies and objectives related to the fulfillment of this document. And by this document, we mean the standard itself, ISO 15189-2022. So this summarizes what a management review entails. It tells us the purpose of the management review. The purpose is to ensure continuing suitability, adequacy, and effectiveness. And it reminds us that as we do the review, we should also look at the policies and the objectives that we had set for the year. In short, management review is a formal activity. It is a planned review by management of the management system. It is not just a staff meeting. It's not an annual general meeting, like I always say to my colleagues. It is a special meeting where top management sits down to then evaluate and review the effectiveness of its management system. Okay, so in short, the primary purposes are to evaluate the fulfillment of the stated policies that we've been running with for the past 12 months or so, assess performance against quality standards, identify opportunities for improvement, and make strategic decisions about resources. Okay, this is very critical. And by doing this, we should be able to demonstrate top management commitment. Okay, so in the legal survey that we carried out earlier on, we noted that in this meeting, our top management, the lab directors, have not joined in yet. And I hope by now the numbers have gone up a bit. The bosses have joined in. We probably have 1 or 2 lab directors, because I did go through the registrants and I can confirm that there are lab directors that showed interest in participating in this. So lab management and top management should show commitment by participating in the management review process. Okay. Management reviews are different from internal audits. Yes, there are systems in place that allow us to go into our system and check whether or not we are complying, but the focus for a management review is different from an internal audit. Management review is about strategic evaluation by top management, and it focuses on system effectiveness, results in resource decisions and strategic actions, right? On the other side, internal audits are a systematic review by auditors who are not necessarily managers. And the focus is on compliance with the requirements and results in corrective actions for non-conformities. Okay? Now, moving on to planning and preparation for a management review. Like we said, it's a formal meeting and it has to be planned. And the key principle behind this is that we should treat management reviews as a formal process with a structured planning, not an informal meeting or an informal discussion where we meet as colleagues, but it is a highly formal process. And planning directs the impacts on the quality of the outcomes of this activity. Okay, so in planning, you need to take note of the following steps. Number 1, you need to establish a schedule and plan for a management review at least annually. If there are issues in your lab, you can plan to have management review more than once a year, but at least annually should suffice. You define your frequency based on the risks. Like I said, if there are issues in your lab and there are risks that are associated with your activities, you may decide to increase the frequency of the management review. You need to set dates well in advance, and you need to coordinate activities with other laboratory or organizational activities. Very key is to align with budgeting and the financial calendar. Often when we get to labs, we look at their calendar for management review. You ask them when the financial calendar runs, you'll see that there's a total disconnect. You'll find that the management calendar aligns the management review with your accreditation assessment, which is totally out of sync with what is happening in the financial side of the organization. And this has an impact. You will find that you carry out your management review, you come up with decisions, you need to buy this piece of equipment, you are not able to get resources from financial director because you are coming in very late when budgets have been finalized and they have been sealed. And whatever you are coming up with has an impact on CapEx, on the CapEx budget. So you need to make sure that you align your management review with the budget planning so that whatever you come up with will be included in your next financial year budget. Otherwise, you lose out and you go for a good 2 years waiting for the following year for your things to be included. Okay. And you need to create an agenda which is aligned with ISO 15189/2022. And the easiest way to do it is just to go through the standard and go to clause 8.91 and get the whole list and use that as your agenda. Okay? Ensuring that you allocate realistic time across all the activities. And you need to assign responsibilities. In this, ensure that you identify people that will collect data, you identify people that will prepare the reports for presentation on the day, who's going to facilitate the meeting, and they need to be empowered and know exactly what is going to take place in the meeting. You also need to assign and train the people that are going to document the minutes or the proceedings of the day and the follow-up corrective actions. So those need to be assigned well in advance, and people need to be trained and be clear with their responsibilities. You also need to identify participants, ensuring that you have enough decision makers participating in the management review. You don't want to have a management review where you maybe more than half decisions are not made in the meeting, and more than half of the issues are going to be escalated to a higher decision-making body. You also need to ensure that you include technical experts so that whatever data you are presenting is technically sound and your technical experts are able to explain what it is that is happening. You also need to plan for substitutions in case a key member is not able to participate. Who is going to stand in on their behalf? And do they have the capacity and power to make decisions on their behalf? You also need to have a clear timeline in terms of planning, at least 2 to 3 months. You need to set the date. Of course, you would have set the date at the beginning of the calendar year, but 2 to 3 months, 8 to 12 weeks, you need to reaffirm the date, identify the participants, and assign data collection people so that you start preparing the data. And then 4 to 6 weeks before, you also need to then follow up on the data collection and preparation of reports and start distributing the material that will be presented in the management review. So you're doing this well in time so that your management review is effective. A week before, once again, you confirm attendance, you review materials that have been prepared, and you gather and prepare questions in advance from the participants, and then you conduct the meeting. 1 week after the meeting, you need to document the outputs, ensuring that you identify and document the key outputs from the discussions. You communicate the decisions, and the standard requires us to communicate the decisions back to the staff members that did not participate in the management review. Okay, so this is very key when it comes to preparation for the management review. Who should participate? It is mandatory that the lab director or top management, I say lab director or top management. If it's a small organization, the lab director will probably represent the whole of top management and will be able to make top decisions. But in other areas, you may find that there is a whole department responsible for finance, there's a department responsible for procurement, there's a department responsible for HR and admin. So those may constitute the top management, and they should participate in the management review. Also key is the quality manager, who is the process owner, and they provide the QMS overview and audit results and quality indicator performance. You also need to have your technical manager or supervisors, your heads of sections participating. These are your technical experts. And you also need to ensure that all the disciplines are represented in the management review, covering your chemistry, your sample R, your microbiology, hematology, depending on how complex your organization is. Now that POCT has been included in this standard, you should also consider having your POCT coordinators if you're working in such an organization, your leads, administrators, and other support services participating. Okay. In terms of participants, once you've identified the participants, you must ensure that all your participants receive material before the meeting, and they must go through the material and understand. They must understand their roles and their responsibility. and they must come to the meeting prepared to discuss, not just to listen to the lab director presenting, but they must be prepared. And this can only happen if they have been given material well before time. And overall, they must be empowered to make recommendations. And those recommendations must influence decision making. Okay. And the team should have decision making authority. In other words, they must be able to approve resources to say, indeed, the budget will be able to cover 1, 2, 3 equipment issues and personnel issues. Such decisions should be able to be made in a management review. Okay. In terms of size, anything between 6 and 12 is optimal, depending on how big the organization is. The problem of big numbers is you end up having many people that are not going to be participating fully, and that may not necessarily add value to the proceedings. And if the team is too small, again, it may not be very helpful. So you should be able to moderate this and be able to trim, ensuring that you keep your numbers small and small enough to be productive in the time given. Okay, so now we're going to look at briefly at some key inputs that need to be discussed in the management review, and some insights on what you should be looking out for in discussing these input items. We are not going to cover all of them. You know the list in 8.9.1, we only have 1 hour to do this presentation. So pick on a few and highlight on a few insights on things that you need to be looking out for. So one of the agenda items is the status of actions from previous reviews. You may have had a previous a management review the last year or so, and you need to go through those actions. Why this matters is to demonstrate commitment to continuous improvement and ensures accountability. Failure to follow up indicates systematic issues. It shows lack of commitment on the part of management. So it is very critical that we review the status of the actions from the previous week. Okay. So what is it that we are reviewing? Please, colleagues, keep yourselves muted. What is it that we are reviewing? We are reviewing the status of the corrective and preventive actions. We are reviewing the completion rates and effectiveness of the completed activities. We are reviewing ongoing actions requiring additional resources, whether or not we're able to complete them because of resource constraints. We're also reviewing incomplete actions with root cause analysis. We're saying to the team, we're not able to complete 1, 2, 3 because of 1, 2, 3, 4. Okay. And we suggest the following metrics for you to be monitoring to show how good you are in terms of performing this activity. Completion rate of the actions. Suppose you had 10 raised from the previous meeting. We expect you to have covered by 9, more than or 9 out of 10 of them by 12 months, because these are issues you identified and you committed yourselves to implementing them. So by end of 12 months, you should have covered more than 90% of them, okay? And the average time to take to close, of course, this is dependent on the nature of the activity, but the average time to close also gives us an idea on how committed you are as the management team. You also need to check the effectiveness score of the actions that you you implemented the previous year. In this, you need to verify if the actions that you implemented prevented recurrence. Okay, so you go through all of them and check if you are able to completely eliminate the issues that were raised the previous year. Okay, so your effectiveness score will show by way of how many of those have ceased recurring throughout the year. Okay. All right, so how do you check your effectiveness? You verify effectiveness by measuring the outcomes against success criteria, which you would have set before. You are monitoring the problem recurrence in a particular area. You are assessing the impact on related processes. Okay, so now you've implemented action. You are also checking if that had an impact on related processes. And you're also going back to your staff, the chamber moment, and checking with your affected staff if the issue that was raised last year has since been resolved. It's no longer recurring. It's no longer an issue. And what are the red flags you should watch out for in this particular agenda item? Repeatedly overdue actions that you are coming back to top management and telling us we could not do this because of 1, 2, 3. It shows there is lack of commitment. Okay? And the same problems that keep recurring over and over again. And if there's no follow-up in the system, those are red flags that you should be highlighting in your management review. Okay. Now, looking at the second agenda item, internal and external changes that are impacting the laboratory. I'm sure as lab people, you've heard of this before. What is it that you're looking for? You're looking for internal changes, and you're also checking external changes. Has there been an organizational restructuring? Are there any changes in key personnel? Are there changes in the facility? Are there changes in the technology or equipment? And any changes in the methods in the past 12 months. So you are reporting back on that and saying whether or not those have an impact on the laboratory. So the key questions you should be asking yourself is, what has changed? Why did it change? Does this have an impact? What actions are needed to respond to this? Okay. And then also you're looking at the volume and type of laboratory activities. This is where you are checking if there are any changes in the volume, if there is any pure CT activity. Now that ISO 15189 is also covering pure CT, you are also checking for test mix changes. You are checking workload versus the capacity in terms of equipment, in terms of staffing as well. Okay, and these changes in the volume and the activities, what impact do they have on the resource requirements? Okay, quality control practices. If you used to run, say, 100 FBCs a day, suddenly you have a huge increase and your numbers are going up. You are now running 500 FBCs a day. What impact does it have on your QC practices? Are you still comfortable running QC once a day? Or you want to consider looking at the risk now, you want to consider and change the frequency? This has an impact and it has a bearing on the cost of running tests in the laboratory. You're also looking at turnaround time performance. Now that you're running more tests, as it has an impact on turnaround time. And of course, overall effectiveness of the laboratory. Okay. And the key metrics to be tracking under this is the total test volume, the volume by discipline, the growth rate, and tests per patient. And this is what you will be reporting on in your management review. Okay. In terms of resource adequacy, now that you've looked at the volume, you also need now to look at the resource adequacy assessment. Okay. You're looking at the personnel resources, you're looking at equipment, you're looking at financial resources. Okay. All right. And then in determining adequacy, please mute yourself. In determining adequacy, the key questions you should be asking yourself are the current resources adequate? Can we meet the objectives and the standards that we've set? What gaps exist? Where are we falling short as an organization? And what resources are needed? And this is the time to then present top management and say, based on this objective evidence, we feel we need an extra staff member in the sample reception department. We feel we need an extra piece of equipment in the microbiology department because we can no longer continue doing things manually with the numbers that we are getting. Key to this as lab people, we should not avoid financial issues. Let's educate ourselves to understand basics of cost per test so that we are able to present these in the management review. This is the language that top management understands. We should be able to present data on return on investment so that we can motivate and ask for more resources. You should not be viewed as people who come in to ask for resources and you are not able to demonstrate how that is going to benefit the organization. Okay. In terms of fulfillment of objectives, you also need to look at that and the suitability of the policy as the standards say. Okay. And then evaluation outcomes and performance monitoring. This is where we're looking into internal audits, external assessments in the past year, quality indicator performance, and you need to look at this holistically and then come back to synthesize the data and identify patterns across all these multiple sources so that you see now you are able to present to top management that we have issues here and we're seeing this cutting across. You need to synthesize data to be able to detect systemic issues as opposed to issues that are isolated in a particular department or in a particular section of the management system. Based on this, you are now able to prioritize your action, focusing on high impact issues that are affecting patient care. If your data is not well synthesized, you will not be able to pinpoint and come up with data-driven resource mobilization. Having done that, you also need to monitor the progress and track improvement trends over multiple cycles. Okay? And then in terms of feedback and complaints analysis, remember as lab and quality personnel, we are monitoring feedback from patients through surveys. We do have processes that allow patients to complain and also user feedback. These are your clinicians that are using our lab from time to time. We need to monitor data on satisfaction, what they are saying about the quality of our results, our turnaround times. We should also give an ear to personnel that are actually carrying out the work on a day-to-day basis to be able to give us insights on how we can improve the process, how we can improve the working conditions, how we can improve on issues of safety. So it is very key that we listen to personnel as well, okay? So in doing this, you are looking at the volume in terms of numbers of feedback. How many complaints are we receiving? It's an issue that we are not receiving complaints. It may mean that our environment is not friendly enough to allow people to say, give us feedback. We should also review trends. Are the numbers increasing or they are decreasing? Are they isolated to a specific area? Are there any specific themes that are being addressed here? Are they complaining about staff? Are they complaining about TATs? Are they complaining about the sample quality or issues like that? And what impact does this have on patience. And at the end of the day, being a management review, we should be able to respond to what improvements are needed in response to what our clients are saying. Okay. And then in terms of quality assurance and result validity, we also need to review data on QC trends and rejections, out of control events, statistical analysis to see how our instruments are performing. This has a bearing on the quality of results that we are giving out. This also, we look at performance at EQA level and comparison with peers. We should also be checking data on accuracy and precision and making decisions on the quality assurance of our laboratory activities. Also, key is improvement actions and the risk and opportunity management, which we talked about last month at length. But just to recap on this one, at a management review level, you are reporting on completed projects that you implemented, okay? You are telling us the outcomes, and you are able at that point to then show us the impact the project had after completion, okay? Report on ongoing activities and also check again effectiveness of the implemented projects. Again, emphasize on the ROI, return on investment, so that your PES holders, your finance directors will see value in supporting your improvement activities. Again, we need to be reporting on risks, taking note of what risks have been identified, what measures have been put in place. Are they effective or they are not effective? If they are not effective, decisions have to be made as to which measures will be put in place the coming year. This may also require resources to be mobilized to be able to keep the risk on the low side. Okay. Again, we need to review external provider performance, and the metrics that you should be focusing on here is the delivery time, the back order frequency, a particular supplier you are dealing with. Every time you place an order, they will tell you, we don't have these items, and supply half the items, and half the items never come until forever. So it's also very important that you check the frequency of back orders so that decisions can be made. How quick are they to resolve the complaints that you lodge if the service delivery is not in place? And this helps top management to be able to make decisions around the performance of the external service providers. And again, here, we're reviewing referral labs. We are looking at suppliers and vendors. We are also looking at consultants for specialist activities such as calibration, and consultants as in clinical consultants for results reporting. Okay. And then we move on quickly to the conduct of the review meeting. So the conduct, like we said, a management review is a structured meeting. We should have an opening session that then reviews the previous actions from the last meeting. Also go through the inputs, the different inputs in a systematic manner. This will also allow you to carry out a thorough analysis of the trends, discuss the root causes, and prioritize issues based on the risk. And this meeting should lead to decisions being made in the meeting. That's why we said participants should be empowered to be able to make decisions in the meeting. It should be clear decisions that are evidence-based, based on the data that is presented, and it should be assigned to specific people as to who needs to do what and when that issue need to be completed. Okay. There should be discussions and decisions around resources to ensure allocation of resources and setting priorities for improvement, and approve budgets and personnel. So remember, I said your management review should be aligned. Ideally, it should come before the budget planning for the following year so that resources are well aligned with the planning for the financial year that is yet to come. Okay. In summary, you need to summarize key decisions, review action assignments, and communicate the next steps. Okay? And then in terms of facilitation, it is always best that we have the lab director leading the meeting, and the following are key to ensure that the facilitation is effective. You need to ensure that your data owners are present. Remember, I said your technical experts should be there to be able to respond to issues that are raised regarding the technical adequacy of the data that is presented. You should be able to use open questions to probe and encourage deep diving into root causes, avoiding a simple yes or no answer. But you should be able to be in a position to stimulate discussions. Try to remain focused. I know if you're calling in a lot of people and there's food in the table, people will try to address all issues that are probably non-related to lab activities. But try to find a clever way of packing all those issues that are not in the agenda and postpone them for discussion at a later date. Assign actions to all the metrics that are in the red. Okay, remember you're presenting metrics against set criteria, and for anything that is in the red that you did not meet the criteria, you should be able to assign actions. None of them should be left unaddressed. Okay, in terms of required outputs in the management review, there should always be an effectiveness statement. This summarizes the overall QMS performance in response to the purpose that we discussed earlier on about adequacy, about effectiveness of the management system. So in terms of outputs, you should always have an effectiveness statement documented. You should have actionable improvement plans that are assigned to specific people with specific timelines. There should be resource allocation decisions in terms of budgeting, how much money is going to be required to purchase equipment, so and so, or hire an additional staff member, or introducing a new piece of equipment. So resource allocation decisions should be made and documented. In terms of service improvement initiatives, you need to be able to document those as well, to say we will optimize our system this way and we will implement the following improvement activities. Okay? Where there's need to change the QMS in terms of update the policies or update the procedures and the scope, there has to be decisions made regarding that. At the end of the day, we don't want to say anything as vague as continue to monitor. These statements are very popular and very common in management review notes that we see in labs, but these statements are insufficient. People, let's make our management reviews more effective by coming up with actionable and statements that will result in measurable outcomes. So continue to monitor. Please, let's refrain from using this kind of terminology when documenting the outputs for the management review. Okay? You need to create effective action plans that will be clear as to what will be done, by who, by when, avoiding vague actions that are not clear as to what will be done. Okay. So in terms of documentation and follow-up, we need to have tracking systems to ensure that all our actions are followed up and they are followed up in time. We need to have regular status updates. We need to verify if those actions are effective. If they are not effective, corrective action has to be taken, or different approaches have to be taken to respond to those actions that were implemented. Okay. We need to have a system of reporting progress, ideally on a quarterly basis, to say we had 10 action items from our previous management review, and this is where we are in terms of implementing those action items. We'll then rush through quickly on technical adequacy, what we are looking for as a management review activity. We are not only looking at the management side, we are also looking at the technical requirements as well. This is why we emphasize the fact that we need to have technical experts participating in the management review. And this is where we'll get insights on resource requirements, process requirements as addressed in clause 6 and clause 7. And then we'll also, of course, review the requirements on the management side. Quality indicators help us identify and get insights on the performance of the system in general. And then monitoring examination performance. This is about the quality of the testing that we are producing in the lab. We need to have these tools in place. I will share the slides with you after this presentation for you to go through this and understand the key issues that we need to be looking out for. And then in terms of strategic improvement, remember we said management reviews should be able to drive strategic decision-making and not just become compliance issues. And I said to you earlier on, when you get to a lab and discuss their management review, understand how the management review is aligned, you look at their calendar, you look at their financial calendar, you realize that these two are not in sync, and you can easily pick that this management review is carried out just for accreditation purposes, and this is just a compliance activity. The team is just ticking a box to ensure that when accreditation assessors are coming on board, they are able to then say, yes, the lab did carry out the management review. But in terms of strategic value, it is not adding anything to the organization, which is why most labs will find it difficult to have your finance team participating in the management review. They will always come up with a whole lot of excuses not to be able to participate in that because they don't see value in that, okay? So the traditional approach treats the review as a checkbox activity. It focuses on the minimum requirements only. It prepares reports just before the meeting and they don't add value. And you want to try by all means to ensure that even the participants don't see the reports before the meeting so that you quickly present and be out of that office as much as you can. But you want to add value to the organization by ensuring that you are using data to identify trends and identify opportunities to improve the organization and improve the management system. You want to ensure that it aligns with the strategic planning of the organization, and it involves leadership in meaningful discussions, and it makes evidence-based resource decisions, okay? You are not saying pieces of equipment being dumped on you because your CEO was on holiday with supplier so and so, and they influenced them to buy that machine. But you are using evidence to influence decision making and drive decisions as to which piece of equipment or which instrument you want to have in your lab. And the benefits of this approach is better patient outcomes, operational efficiency, staff engagement, and of course, accreditation success. I said accreditation should not come first, but patients should come first and align with the accreditation requirements. Okay? And then linking management review to strategic planning, align your strategic goals to decision areas around technology and automation, new platforms, to workforce management, using data to come up with planning for succession, using data to come up with planning for training, and of course, the staffing numbers. Using data to facilitate space utilization and influence resource mobilization for renovations and safety, and of course, having an impact and decisions around the financial planning based on the ROI data and cost management that you are presenting to your top management. Okay? And management reviews should be able to drive continuous improvement. And some pitfalls that are quite common that you should be watching out for in terms of ensuring effective management reviews. Inadequate preparation is one of the key ones. Like we said, you start planning 8 to 12 weeks before so that you ensure your management review is effective. And lack of leadership is a key one. Directors should be part of this activity and they should be the ones driving it from top down, okay? And then omitting key inputs, ensure that you are covering all the inputs requirements from clause 8.9.1, okay? And then in terms of documentation, often when we get to labs, we see incomplete reports. And when you discuss with the lab, you talk to the team and they will tell you, no, we discussed this. It's just that the person who was taking down notes did not take down what we discussed in the meeting. And they can even show you the notes that they scribbled on as evidence that indeed that issue was discussed on the day of the management review. But the final report does not include everything that was discussed, which is why we said in preparation, you need to align and assign key personnel in advance and train them as to how they should take notes on a management review and how they should produce their reports, okay? And then also we see a lot of lack of traceability. You find at times the final report is talking about 1, 2, 3. And then you ask for the input report, nothing. There was nothing like that that was reported in the meeting. There's lack of traceability. Or you have a nice report that was presented. You ask for the quality indicator data that was produced throughout the year. The report is nice and clear, but it's not traceable to data that was collected on a day-to-day basis. So it is important that we ensure traceability of the reporting that we make out of a management review. Okay. And then again, we have issues for most lack of leadership commitment, which is shown by the different matrices that we talked about earlier on. So what we need to be doing as lab people is to educate our top leadership as to the importance of management review meetings and ensure that our management reviews are designed to make and influence strategic decision making as to opposed to ticking boxes. Okay. And here we review just a bit the tools that you should consider for planning and data collection, discussions, and the outputs that you make in the management review activity. Okay. You should also consider quality indicator dashboards, and these are very good in ensuring that your data is presented visually. The brain appreciates that better than numbers. You should also, in your presentations, consider using Pareto charts to justify why you are focusing resources on certain areas using the 80-20 rule. And as lab people, I know it's an area where we are all happy and comfortable with. Okay. In terms of the implementation roadmap of management reviews, if you want to improve your systems from zero to aligning your management review, ensuring that they are effective and they are more strategic in terms of influencing decisions, we suggest this roadmap for your consideration. What are the key success factors that distinguishes a successful management review from just a compliance exercise? You see leadership commitment, visible engagement from the lab director. There is comprehensive preparation well in advance, and the process itself is structured. We have a formal agenda, we have data, and everything is traceable. We have meaningful participation from all the attendees, and decisions are data-driven. They are not based on emotions, but they are based on the evidence that is presented and the objective evidence that is analyzed on the data that is presented. And there is also evidence of follow-up and accountability with a clear tracking system. There is also evidence of continuous improvement. There is integration with operations of the organizations, ensuring that the outputs are aligned with the lab strategy and they are aligned with the resource allocation. They are also aligned with business planning. There is also evidence through training and competency. Thus, those are coming from the key outputs of the management review activity. Okay. And of course, there is top management ownership. If there is top management ownership, there is transforming management reviews from just being check boxes, but to becoming activities that have strategic impact and organizational commitment, leading to visible allocation of resources and resolving emerging risks proactively, but not responding to issues once there are problems. Okay. All right. So in transforming management reviews from compliance to strategic leadership, there is need to embed leadership key performance indicators. There is need to consider rotating facilitation roles. Remember, we said the lab director should facilitate, okay? But as top management, it's not only centered on one person. To show commitment, there is also need to consider rotating, and also there is need to showcase any tangible wins and celebrate them with the team, acknowledging the team to be putting effort in the right direction. This fosters a positive culture in maintaining and promoting quality in the organization. Okay, so colleagues, this brings me to the end of the presentation in terms of the management review. But if you are able to scan this QR code, you'll be able to participate in a short quiz. I think it's only 20 questions, and we've set the pass mark at 85% and above to be able to earn yourself a certificate. We will share the link on the chat box as well. Let me quickly do so. Okay, I'll share the link after I pull down the slides. But for now, let's just continue with the rest of what I have in the slides. So as CLISS QA, we offer training services, and currently we have the following training activities. We have what we call the ISO 15189 2022 Bootcamp. This is a 5-day training that we offer. On day 1, we look at the understanding of the standard and the requirements. We look at day 2, documentation. We look at implementation and continuous improvement. We introduce internal audit planning and execution and reporting. So this is the ISO 15189 Bootcamp that runs over 5 days. We also offer a course on risk management. This is a 2-day training that covers theory and introduces practice through the different tools that we have. In this, we cover context and policy, risk planning, hazard ID. This is a mini workshop, risk estimation, risk evaluation and acceptability, risk control, residual risk and benefit analysis, monitoring and continual improvement. We also have a 2-day continual improvement training where we focus on mastering the identification of opportunities for improvement and implementing quality improvement projects. And we cover all those different modules in the 2-day training. We also have a full-day training on management of non-conforming work. And these are pictures from a recent activity we conducted in one of the private labs in Gaborone, Botswana, where we were looking at risk management in medical laboratories from theory to practice. And this is a 2-day course that is currently on offer under the CLISS Quality Advisory banner. And we are inviting you to partner with us. We are available to offer training and mentorship virtually. If you want to invite us to your country, we are available anytime. You engage with us, and this is how you can engage with us through Facebook. We have a quality advisory page on Facebook. We are visible on LinkedIn. Our email address is info@clissqualityadvisory.com. And our direct line is +267 76 540 559. And if you are one of the tech giants, you can scan the QR code and also reach out to us. We'll be able to respond to you. Okay, so let me quickly share with you the link to the quiz. If you complete the quiz, you will automatically get yourself a certificate. Okay. That's it from me. do we have any questions or accept a question or two from the participants? Any questions? Koda, are there any questions from the chat box? Sorry, I was not able to go through the chat box.
No, there are no questions in the chat box.
There are no questions.
Yes, except for maybe there's Susan Ngugi.
Sorry, Koda, I can hardly hear you.
Okay, there's Susan Ngugi who indicated that perhaps you could share the dates or calendar where you offered trainings.
Okay, okay. Yes, definitely we will do that. We'll be able to share with you our calendar for 2026. But in addition, we'll be able to share the slides for today's presentation, including the link to the recording for today's webinar. We will share with the participants. But otherwise, thank you very much to everyone for your participation in this webinar.